before we get to them, we're going to have our organizing committee chairperson. She is Cheryl Lam from Mo University. I'll let her introduce herself more. Welcome, Cheryl.
Hi everyone, my name is Cheryl Nam. I serve as MSAKE OC person. This has been an amazing journey, and I have gotten to interact with so many people, so many of you. The speakers, the numbers. It's been an amazing experience for me, and I'm pretty sure many people have benefited from this. And also, we still have the recordings of this. And I'm actually really glad it was online because it was very flexible. So this has been an amazing experience for me. Yeah. Yes, thank you. Over to you, Martin.
Thank you, Cheryl. I must agree with you that it really was lucky that the session was online because I'm sure people who wouldn't have been able to make it to the physical conference got the chance to experience what a General Assembly and MSAKE is like. So, really grateful for that. Our next speaker is Dr. Were, and he is called Dr. Andrew Were. He is a senior postgraduate student at the University of Nairobi in plastic reconstructive and aesthetic surgery. His leadership prowess came to during his undergraduate days, where he served under Amsun as the chairperson. He then co-founded and served as the first president of MSAKE, which later grew to what it is right now, and the reason that we're having this conference today. He was very instrumental in the establishment of KMPDU and served as the Secretary General from 2012 to 2013. And his passion towards the welfare of doctors and the provision of quality healthcare cumulated to his election as the president of KMA in June 2020. So, Dr. Were, we're very lucky to have you here today. We're looking forward to hearing from you. Karibu sana.
Hello?
Yes, we
But
can
I
hear
don't know
you.
whether you can hear me.
Yes, thank you. Welcome.
Yeah, thank you so much for inviting me to this closing ceremony. Um, I'll be happy to participate and contribute. I was told it's a question and answer session, and I'm very glad to be part of this team, having been MSAKE founding president. So thank you so much for inviting me. I'm happy to participate.
Karibu sana, Dr. Were. We're glad to have you. And before we get to your question and answer session, I think we can have the MSAKE president speak because he has a commitment at 5. This is Nicholas Kioko. He's also from Mo University and he is the Secretary General to MSAKE. Welcome, Nick.
Hi everyone, I hope I'm well audible. Thank you so much, Marlene, for the invitation. And thank you everyone for finding time to attend this closing ceremony. Indeed, it has been 3 impactful weeks for the association. And for the first time, we have had an online General Assembly. That has never happened before. And this being the 4th General Assembly, marks the very first online General Assembly where we have had increased participation. The first GA was held in St. Andrew's Turi in 2016, and then we had the second one in 2018, and the third one in 2019 at Oloika Lodge in Nakuru, and this is the 4th one, although it was supposed to be a physical GA in Eldoret. we didn't get to attend because of what happened this year, the problems with the global pandemic. But either way, we got to have a very amazing General Assembly. I think it was one of the unique ones, and not like any other that we have had before. And throughout this year, we have seen increased participation among the members from the various universities, and we really appreciate that. At least we got a report that we had over 150 people registering for the General Assembly, and that was really amazing on our end. And that tells us that people are taking ownership of the association, and they're willing to stay forward to greater heights than where it is now. And during this General Assembly, unlike the previous General Assemblies, we had special sessions. For example, we had quite a number of workshops, quite a number of open access, where we had amazing speakers. And this is for the first time where we have had almost over 10 speakers. So that was really, really great in terms of the work of the organizing committee. And these sessions got to engage people, and they provided an avenue for learning that I think those who have attended this GA, they are coming out with something different from in a different way from the way they came in. And I think that is a great addition, and that marks the value of having a General Assembly. And the theme of this General Assembly was youth and universal healthcare. And we got to have various sessions that tackle this topic. And the first one was regarding the COVID-19, pandemic preparedness. And this one was timely because we are currently facing a global pandemic, and it helped us know how to prepare for such pandemics in future, and our role as the youth in combating future pandemics. And that, coupled with the emerging and re-emerging diseases session that we had with Dr. Masika, I think it helped bring to light what our role is, and how we as medical students and future healthcare professionals can partake in combating or preventing such re-emergence of diseases or emergence of new infections and diseases in general. And the fact that we handled meaningful youth engagement, that by itself is a very huge gap for us as an association, because I think that is an area that we have not really covered well, and that is something that should be a priority for the incoming executive board elect. And the third one was regarding the actual theme, that is the universal health coverage and the role of the youth, where we had really amazing speakers, others from outside the country. And from what they all talked about is that we have a big role, yes, the youth, in promoting advocacy work, being engaged in decision making, not only at the university level, but also at the national level. And MSAKE and even IFMSA provides you an opportunity to learn how to come up with policies. And that is something that we need to start this year, to see how we can start making policies on different things. And we continue to encourage people, if you think there is something that we as an association should have policy on, feel free to approach the executive board that is incumbent, or the one which is starting next year, and we'll see how we can work with you to come up with a policy. It's not a must that it's perfect, but the fact that we are willing to try to come up with these policies, it's a big step in advocacy work. And also IFMSA has various small working groups for various policies. So that is an avenue that you can also venture into to learn the process of policy making. And once you get that building from the basics, then you can now partake in national policy making or decision making and advocacy work. So those are avenues for personal growth and value addition among the members within our association. Apart from that, we are really glad as the executive board that this year has ended with an amazing General Assembly despite the challenges that we have experienced through the year. And every person who has contributed to where we are today, they have worked really hard, starting from the national officers for their various standing committees. I really congratulate them for all that they have been doing. And even the COVID-19 task force, I think you have had a really major role in promoting our activities. And as I said in the opening ceremony, putting MSAKE on the world map of COVID-19 response. And I think Dr. Were, being the KMA president, can attest to the fact that MSAKE had a really great contribution to the response of COVID-19 in the country. And we appreciate all who had an input in that. And we are glad that we already awarded you certificates for that. And we urge you to continue participating in other activities that take place in the association. And also, regarding the General Assembly and its theme, we urge the organizing committee to make recommendations to the executive board on what on the outcomes of the General Assembly and what you think should be priorities for the next term. Because the purpose of having a theme for the General Assembly is to contribute to identifying the gaps that are currently there, and that and identify opportunities that we can venture into as an association to grow in terms of our scope and members engagement. So I would like, if it's possible, Cheryl and team, you can make up recommendations on what should be the next priorities for the next term, based on what we discussed during this GA and based on what was advised by the various speakers. Otherwise, I take this opportunity to thank the organizing committee for the good work and working tirelessly despite all the challenges that we experienced. And at one time, I remember we were not sure that whether we were going to have a physical GA or an online one. And they really worked hard despite all that uncertainty, and we got to have an amazing GA. Thank you so much. And also all our members for finding time despite the busy school schedules. I understand that most of the universities have online classes, but we still got time and made time to attend the General Assembly. And I hope all of us have got something out of it. And I take this opportunity to also ask you, if you missed on some of the sessions, you can go to our YouTube channel. Most of them have been broadcasted there, and one of them has been broadcasted on our Facebook page. You can watch them there and catch up on the sessions that you missed. And I wish everyone a fruitful month ahead as we got for Christmas, and have a lovely end of the year. Thank you.
Okay, thank you, Nick, for that. We will do that as the organizing committee. I feel like after having experienced all the planning and actually engaging in the General Assembly, it's something that I want to do in the years to come. And I would encourage everyone here to also participate. So I think we can now move on to the question and answer session. And before I start, let me just say that if you have any questions directed to Dr. Were, you can just post it in the chat box, or you can raise your hand and I can unmute you to ask the question verbally. He is supposed to speak on the topic leading through the changing world of health. And I'm sure all of us here have been leaders in some way, or would want to be a leader in different aspects, either in the future, in the near future, or in the far future. So I'm sure we can all gain a lot from this. So, Dr. Were, my first question to you is, as one of the minds that established MSAKE many years back, if you compare it then and how it is right now, would you say that it is growing towards what you had imagined it to be, or what you had planned it to be when you started it?
Thank you for that question. Um, as you all know, MSAKE was founded in 2008. And this was during that time, we had two medical schools. This was University of Nairobi and Moi University. So the leadership of SAMU and AMSUN met, and we having been inspired by TAMSA, which is in Tanzania, then we saw it fit to have an organization that can champion and represent the interests of all medical students in Kenya. And at that particular time, there was news of opening up of other medical schools. So I'm very proud of what MSAKE has been able to achieve over the years. And talk to your former president, Nicholas, we are actually, as Kenya Medical Association, we look at working very closely and tapping at the innovativeness and the way MSAKE plans these things. And we are very impressed. And as a founding president, I think you have been able to meet and even surpass what we envisioned as leaders at that particular time. And we'll be happy to
Okay, thank you for that. Okay, being fairly new to MSAKE, I must say I am also impressed with what it's doing, and I can't wait to see where it's going. So thank you for that answer. And throughout your time in leadership, right from when you are the first MSAKE president to where you are now, what would you say are the major challenges that you have faced? If you could, divide it into when you were a student leader and after that, like after you became a doctor, what were the challenges you faced as a leader then?
in first.
Sorry, I didn't quite get you.
I'm saying, please repeat the question. I didn't get your question.
Oh, okay. I said, okay, throughout your term in leadership, right from being the first MSAKE president to when you became a professional doctor and the positions of leadership that you got then, what are some of the challenges, the major ones that you faced, and how did you overcome them? How did you deal with these challenges?
Yeah, thank you. I think when we founded MSAKE at that particular time, our initial challenge was to recruit members and convince students from the two universities who already have had an established student association to join and be part of this new vision. I think that was one of the challenges we faced. But of course, when we left it, the second leadership, Umonduga took over, then they were able to address those challenges. The biggest challenge that we face even now amongst doctors, the bigger issue is the issue of convincing most of the members, both doctors, in terms of the importance of coming together and fighting for a common cause. So I think that has been our biggest challenge, trying to come together and help people to purpose. And I think it's something that we still need to address it as we go forward.
Thank you. I think I have some experience with that. Okay, being part of some getting people to participate, especially specifically in this time during the pandemic. I guess this is something that everyone can relate to. Things are tough, especially with there being a lockdown, things moving to virtual platforms and being online. I guess people don't necessarily get the time to participate in this. So getting people to attend the things that you plan for them, and also the webinar lag, that is something that I have also experienced. So would you please tell us how you would address something like this? how would you get people on board to be part of this common cause? What are some of the things that you did? Dr. Were?
Eileen, sorry, I'm having a bit of challenge. I'm in Kilgoris and it started raining, so it's affected the internet. Can you give me 10 minutes? I just then we get back to the question and answer session.
That's fine. It's okay. It's fine. So as we wait for Dr. Were to get a stable internet connection, let me see. We were supposed to have Ezra say a speech. I don't know if he had joined in yet. I think I had seen him. Oh yeah, he's in the waiting room. As we wait for him to get settled, is there anyone who would like to say something about their experience with the GA, what they learned, what they were inspired to do? Just raise your hand or you can unmute yourself and just say something. Yes, Barbara.
Hi, Marlene.
Hi.
So, hello, everybody. For those who, okay, many of you don't know me, I'm the outgoing national officer for Cora. The one thing I wanted to hear from generally everybody, I really love criticism, and I would appreciate it if all of you told us what you think this EB, like on behalf of all the national officers, what you think we could have done better, especially in this pandemic period. I feel like if we hear it from you guys, it will be a roadmap for the EB elect so that they know where to start from and what to work on, especially after our term ends. Yes, please, guys, please. I would really love criticism. And feel free to criticize me. I really appreciate it because I feel like it makes us grow. Yes, that's what I wanted to ask.
Okay, thank you, Barbara. So all of you have been asked a question. Is there anyone who would like to respond to that? Yes, Cheryl.
Hi guys, hi Barbara. Thank you for that question. Uh, that's for everyone, but I can give my experience of SAKEB this year. I think given the circumstances, the EB has done a lot and has done what they could in to the best of capacity they had. Especially Scorer, there were a lot of events and there was a lot of events and volunteering that took place this year, and I think that was a very remarkable step from you guys. So mine is not much of criticism but praise, because I think given the circumstances, I think you guys did pretty well. Yes. So yeah, that's it. Yeah.
Thanks, Cheryl. But I'm really looking for criticism. Like, I really want someone to criticize. And I'm here on behalf of all the other national officers. So if there's anything you feel like we should have done better, please say so. It's important so that the next EB knows that they need to work on these specific areas. And the one thing I've noticed, even in IFMSA, it's very important for you to leave behind what you could have done better. Because yes, maybe my committee thrived, but I know for a fact there are very many places I did not do well. And I know many of you might have noticed one thing or another that I might not have given my successor. So if you have any other input, please, I am begging you, even if it's directly messaging me, I need that criticism. I need to also grow. Yes. But thank you so much, Cheryl. I appreciate it and I'm humbled. Yes.
Thank you, Cheryl. Is there anyone else who would like to say something? Let me see. We are about 17, give or take, participants in the meeting. There must be at least 5 people who have something to say. You can even post it in the chat box. It doesn't have to be verbal. Anyone? Okay. This is new. Okay, as we are waiting for Dr. Were, I don't know if Dr. Were is ready. When you are, just let us know and we can continue. Let me see. We have a few members from the organizing committee here, and I hope they won't hold it against me if I ask them to speak before I choose one. Can one of them offer to speak before I pick a specific person? Okay, I'm sorry for this, but Hamza, would you like to say something with your experience with the GA? I'm sure you have moderated several sessions. So could you please tell us how that was for you?
Hey, thank you, Marlene. I totally wasn't expecting that. I thought you'd choose someone else, but yeah, thank you. My experiences with the GA have been actually really. I learned quite a lot interacting with the members themselves, uh, getting to network with the doctors themselves, the panelists. It was really like I really learned a lot. It's a bit sad. It's a bit sad that it's ending. All the months of planning, everything is now coming to an end. And then I really wish it was physical and not be online because we'd get to meet. But nonetheless, we look forward to next year. Yeah. One thing I like to say is that with the online one, we had a really good outreach in terms of the content that was discussed amongst the panelists. I'd suggest to everybody logged in right now, if you can go in your free time to go and check them out online, kindly do so, because the content that was spoken amongst the discussions was excellent. So in your free time, I'd suggest you go and watch them. But yeah, other than that, we thank you all for regularly joining in. It's been a really long 3 week journey with every day something or the other. Don't worry, we will be back next year. And yeah, thank you so much for joining us and making the GA a success. Thank you.
Thank you, Hamza. I agree with you that what was taught during the sessions was really, should I say, mind blowing. There's a lot that I did not expect to learn, even with the topics that we had selected. And it was great to meet those people who facilitated the sessions. I'm sure were it not for this virtual GA, I would not have met most of them. So I'm really grateful to have had this experience. I don't know if Dr. Were is ready. I can see he's on.
Yes, Malik. I think I'm in a better place. I think we can go on. Sorry about that, Mr. Blazer. I was driving, and then we met some very big storms. So we decided to stop and then have the meeting first.
It's okay. Now proceed. Okay, you had said that one of the challenges you experienced as a leader, both under MSAKE and even with KMA, was consolidating people for a common cause, or from SAKE, convincing people to SAKE is something that we want to do. How exactly do you convince these people? Sure, not everyone is of the same mind. Not everyone has the same perspective with these things as you do. So what exactly do you tell them?
Thank you. So, one of the things, and I'm sure even the past leadership and the current leadership of MSAKE are experiencing, is medics are one of the, if I may use the term, queer or very opinionated group of people that you really need to dig deep to be able to convince them to be able to join your cause. So one of the things that I think has worked for me during my time in MSAKE and as a KMA president is the ability to do wide consultation, to be a leader that is able to listen to almost opinions that are brought forward, in as much as some we might not like them, some might be diverging, but giving an ear to all these diverging opinions and convincing people that this is the best way to go. So one key thing about leadership, you have to be able to listen, whether it's things that you want to or you feel uncomfortable with, and then being able to sit down and convince the other party or the other person that this route that you want to take is in the best interest of the fraternity. So it's a challenge that I'm sure even the incoming SAKE leadership will face, and it will continue even into the medical fraternity once you guys join us as doctors. So ability to listen, being innovative in terms of how you approach things, and always remembering why you're in that leadership is to serve and to make it better for the coming generation, and being able to accommodate different diverging opinions. So I think that for me has been has worked during my time in SAKE and during my time as the Secretary General of the Union, all the way to KMA.
Great, thank you. You really mentioned an important point. Understanding that the people you're leading also have their own opinions, and listening to them is very key. So with the current pandemic, there have been a lot of things that have happened. People have lost their lives, and specifically, we've had doctors who've lost their lives, mostly because the government has not provided the necessary PPEs for them to use in treating patients. and there has been a great uproar, especially online, about how the government is not doing enough for the doctors and also for the Ministry of Health at large. What would you say about this? Do you agree with people that the government is not doing enough?
I fully agree that the government is not doing enough because we live in a very interesting country where uh, we have uh, looked at medicine as a business and not as a service, and everyone wants to make a kill from anything. So, I'm sure all of us know about the issue of the scandal in KEMSA, the issue of the COVID-19 millionaires, and sometimes it's normally because of a crisis of leadership, all the way from the ministry and the people who are in charge of health in the counties. So, and that has led to formulation of poor policies and response to this COVID pandemic, where the focus is not in providing care and protecting the healthcare workers as they serve, but in making a killing out of this pandemic situation. So the government has actually failed healthcare workers, but that has not stopped us in our different leadership positions in the in Kenya Medical Association, in the union, in continuing to advocate for better spaces for us to work in our facilities, protection of the healthcare workers. Currently, we are pushing for vaccines to be prioritized by January and be given to all healthcare workers to protect them as they serve. So, but despite the misgivings of government, we have not given up and we continue fighting and pushing for the same message, which is protect your frontline healthcare workers so they can be able to serve.
Thank you for that. And I think, I don't know if I saw this, I think it's something that has been going around on different online platforms that I think it's a message to medical students that once they're done with school, as soon as they're able to, they should leave the country and not join the jobs available in this government or in this country. What advice would you give to medical students who are currently either in undergraduate or postgraduate and are going to work for Kenya? Should they follow that path and actually finish and join the county hospitals or the government hospitals? Or would you advise them to actually leave to get better opportunities outside the country?
That's a very tricky question because you have to balance between patriotism and uh, self-interest. If I was 10 years younger, and currently what is happening in our country, I'll have left. I'll have done the clubs for UK or USMLEs. And because our government is not really taking care of us and prioritizing human resource for health issues in terms of employment of young doctors, I'd be really hard pressed to say that be patriotic and remain around. I'll actually encourage you as early as possible, like, as you do your 4th and 5th year, you can do your SMLE part 1, and then as you finish, then try do the other entry exams that you need to do. Canada is a good destination, US, UK. And as you go out, I'm sure, even as you join residence in those foreign countries, for us who are stuck here, we'll continue fighting for improved working space so that you guys can come back. In 2010, with a group of friends, when we were forming KMPDU, we were actually faced with a similar challenge because most of our colleagues were actually going and to other countries to seek greener pastures, but we remained behind and decided to improve the working conditions so that, and the pay. And that has actually led to arresting of a brain drain, especially of doctors to other countries. But as we speak, and the attitude and the response that you're getting from the government, I think I'll be right if I can advise that once you finish your internship, because you really need to do the internship here so that when you come back, you don't face challenges of registration. If you go out and you don't do internship, when you come back and want to be registered, when you come back even as a specialist doctor, you might be forced to do an internship, and that is the law that we have here. So I'll encourage all of you, if you get the opportunity, take it. If you remain behind, please join KMA. Please join the union so that we can be able to together to advocate for better working place, to advocate for improvement of our health infrastructure in the country, so that we can be able to serve our people.
Thank you for that. You have mentioned advocacy, and during the GA, we've had sessions on policy making, global health, and advocacy. And one of the main things that I remember is that to actually work so that these policies are put in place, you have to have a relationship with the policymakers. And in this case, that would be people in government, because they have a say on what happens. How would you say this is this really applicable, especially in a situation as we have in Kenya, where politics is really on the rise, especially in this pandemic? Something that you would not expect is for people to be hyping politics and placing it above health, something that is very critical. So would you say how easy is it to work with leaders, government leaders elected, in implementing these policies that we are advocating for, especially in terms of health?
Thank you, Malin, for that. I think one of the biggest handicaps we're having as medics and as practicing doctors is you have not been able to tell our story well and consistently to the public, so that they can be able to be educated and understand that the decisions they make at the ballot box affect them. So that is one thing that you have not been able to do well, but I'm sure some of you have had Daktari Omta and other doctors who are blogging and other, even students. And this has started giving our story to the public in the way they can understand and connect with. Recently, the advocacy issues you've seen from the association, we have actually, as we fight for protection of healthcare workers, we've been able in Twitter to tell the story of how we are actually losing our colleagues because of lack of basic commodities, and the public has actually sided with us. But we need to go beyond that, and that's where now the collective responsibility comes. When we graduate and become doctors, we need to be actually, as we take the oath, to protect each other, to be a brother's keeper, and the only way you can do that if we bring our voice together under the association or under the union for the industrial relation issues, and then being able to work towards approaching the policymakers. As KMA, we sit in different boards and agencies of the government. We also sit in different committees in the Ministry of Health, and through that, we are able to actually make our voice heard. So from our different chapters in the country, we're able to collect information and we're able to bring it to the table. And that's why I'll urge all of you and the graduating class, please join KMA so that you can be able to do this together. As part of my mission or vision to increase advocacy in the health sector, we have actually established an advocacy and communication committee in the Kenya Medical Association, so that you can better tell our story, so that you can be heard and connect with the public and policy makers. And I'm happy to announce that we'll be actually taking members of MSAKE who will be serving in those committees of KMA, where we'll be pairing the standing committees of MSAKE together with the standing committees of KMA, so that where doctors we fail because of a busy schedule, then we can have MSAKE actually supporting KMA so that you can better advocate. So if we work together and we realize that we are all one fraternity, then I think we can better advocate for change of policies which will improve health in this country.
That's really great. You heard it here first. You will be having opportunities to join committees in KMA, and I think I would advise you to take it up. I think one of the things I also remember from the sessions that we've had is that most students, undergraduates, after graduating from medical school, even if they had taken part in activities, standing committees while under MSAKE, most of them after graduating, they stop all this. They just focus on the medical part, being clinical doctors, and they don't really take part in advocacy and things that they had been passionate about during their undergraduate years. I think having something like this with KMA will act as a bridge to you starting this association and organizations and partnerships with fellow doctors after you graduate. So you should start now and never stop, because if you stop, you might never start again. That wasn't meant to be a quote, it's just something I was saying. So at this moment, I would like to open the platform to questions from the audience. You can lift your hands, you can post your question in the chat box and it'll be answered by Dr. Were. So ask your questions. Okay, we have one from Cheryl. What do you think as a leader? What do you as a leader think will change the whole situation, and how close are we to that change? What can we do as med students? And is advocating and crying on our statuses and Twitter the only thing we can do? I think this is specifically directed to the government not doing enough for medical doctors and the Ministry of Health at large.
Yeah, thank you for that question. I think the situation is not hopeless. And if I can give an example, during the time when you are at home and we as KMA were on Twitter trying to push for you to come back so that you can add to the workforce, especially in this COVID area where we are seeing so many doctors going on isolation. So we needed you guys to graduate and come join us so that we can be able to fight this pandemic together. Twitter is a very powerful advocacy tool, and it's very effective in terms of passing the message, but we need to go and do more than that. So, and that's the opportunity that when I became the KMA president, I noticed that yes, we are there, we are shouting, writing letters and stuff, but there's something that is lacking, which is after you've written the letters, after you have tweeted, then what? So what we decided to do is, as part of the mentoring and to ensure continuities, is actually this issue of pairing the committees of MSAKE and KMA and having internship opportunities for MSAKE members within KMA, so that you can learn advocacy from a very early stage, so that by the time it's your time to take over the leadership of KMA, then you're well versed in how to better advocate. Two, KMA, if you walk through it, then we have partners, donors who actually work with us, and they can actually support us in most of the issues that we face. A good example is, like, for now, the issues of doctors not having employment and stuff. We are actually looking at building a very big hospital where it will accommodate our members, which is doctor-owned and doctor-run. So what we need to do is to come together, join the association. Students are able to join the association as associate members. We pay 1,500, and then we work towards addressing the challenges. The thing that we normally miss, and last year we formed the Young Doctors Network, was the senior colleagues were out of touch with the problems that we face as younger doctors. So when you form the Young Doctors Network, you gave the opportunity of the younger doctors to actually have their voice heard and to actually work through the association to be able to address the issues. So working together, we can be able to solve most of these issues outside of tweeting.
Okay, thank you very much. I hope Cheryl has been answered fully. We have another question in the chat box. What would be the focal point of a health service commission in our practice of medicine and our lives as doctors and future doctors?
Thank you. So the Health Service Commission, if I just give a history a bit, was actually envisioned before the Constitution came into force in 2010. But unfortunately, we were not good in having our voice heard. The teachers got the Teacher Service Commission, while the Health Service Commission was struck off. It was there in Bomas, but struck off in the meeting in Naivasha. Then when we formed the union, we realized that the human resource aspect in terms of management at the county level is being mishandled because one, the devolution of the health sector was rushed, and then two, at the county, there was a lot of political interference with the MCAs, and also because of lack of pull factors at our counties, most doctors chose to stay in the cities and urban areas. This meant that we did not have an equitable distribution of health workers when it comes to issues of their promotion and their training needs. Every county has a different policy on that. And this affects our growth as doctors, affects professional development. So what we thought will work then was to have a commission that will be able to address these challenges that we are facing from internship, from employment, from promotions, from professional development. So we needed a centralized body to be able to handle it so that it can be effectively handled. Health remaining devolved is a good thing because it brought services closer to the people. The only problem is that the human resource aspect, the doctors are very few in this country. We are currently at 13,000 doctors with 2,000 specialists, which cannot serve a population of more than 50 million. So the Health Service Commission will come in very handy in terms of addressing the human resource issues that affect us as doctors and make sure that there's harmonization in terms of the benefits, the training, and the progression. And that's why our Constitutional Health Service Commission is a very key thing for us to have in this upcoming BBI conversation.
Thank you very much. I hope Gudu has been answered well. I think we can move to the next question. There's one from Keegan. How is KMA looking forward to support MSAKE in the future?
Thank you. So, as I've mentioned before, MSAKE and the KMA are tied at the hip. The good thing is, as the KMA president, I fully understand from the inception, I've been the founding president of MSAKE, what the mission and the vision of the organization was. So what we did last year, even before I became the president of KMA, we pushed for a seat. So the MSAKE president now sits in the National Governing Council and is supposed to be attending all our meetings so that he can be able to put the agenda of MSAKE there. And I've also mentioned we were working with the past president, Nicholas, in terms of providing mentoring opportunities for students. We are also, and that we're going to provide internship opportunities where we'll be able to mentor you on how professional associations work so that when our time comes to leave, then you can be able to pick the baton and address the issues affecting the fraternity. Other than that, there's so many other things we're working. We're working on with Benjamin. We are currently planning on white coat ceremonies for the incoming students through MSAKE. So there is so much that you can do, but it has to be driven also by MSAKE in terms of, because they better understand the needs that you have. Yeah, but KMA will always support and MSAKE in its activities as we have always done.
Thank you for that. At this point, I will open the stage to anyone who would like to ask a question verbally. You can just unmute yourself and ask. Don't be shy. Okay. Yes, Benjamin.
I must say that Kemi is doing a good job. MSAKE has also done.
Benjamin, we are not getting you clearly.
Sorry. Are you able to get me now?
Yes, loud and clear.
All right. Thank you. So thank you so much for this opportunity, and I want to appreciate the work that Kemi has done, as well as MSAKE. It has been a year full of challenges, but at the same time, we've seen so much growth. And I want to appreciate the leadership of both organizations. The question that I would want to ask is, 2 years ago, the Kenyan government employed 100 Cuban doctors in our country. There's rumor that the government still wants to employ more Cuban doctors. At the same time, there are more than 1,500 unemployed Kenyan doctors who have graduated from medical schools recently. Does KMA have a say on that? Will it be able to influence the government standing on the same? And at equal measure, I understand that if a Kenyan student trains outside the country to do trains medicine outside the country and then comes back to the country, for him to be licensed, then they have to do some exam, and that means that there's some limits to that. Does KMA or KMPDC have a way of curbing the kind of doctors that are coming from Cuba? Thank you.
Thank you, Benjamin, for the question. So the Cuban issue is, if I can make you understand, it's a bilateral agreement between two governments. So sometimes there's nothing much you can do about it. But you have been following the conversation being fronted by Kenya Medical Association. The issue is it value for money? Is it having any impact in terms of service delivery? And the question, the answer for that is a big no, because we have requested the Ministry of Health to share with us the audit report in terms of the effectiveness of the performance of these doctors. And this has not been done. So it means there's something beyond that. And remember the Cuban conversation came in after a strike, the 100-day strike under Dr. Oluga. And so I don't know whether it was a way the government was trying to reach to punish doctors, but it's unfortunate that the Minister of Health has also indicated that they want to renew their contract, provide them with the cars, which we actually pronounce ourselves and requested for the audit report to be given. So what we can do, and we continue doing, came, and I think it's about time that we have this conversation. If we are not having enough employment opportunities for our members and our associate members who are the students, members of SAKE, then what can we do about it? As doctors and as KMA, we can be able to attract funding and be able to build our own hospitals and our own chain of clinics where we'll be able to employ ourselves and be able to provide service to the public. And that's one thing that I'm very keen on doing, because when you have a government that trains its own people using its own resource, and then can afford to have them just idling at home with no employment, then I think it's time we change tact and address those issues together and differently. And the only way we can do that is to create those employment opportunities ourselves. And once we do that and we provide quality service, the patients will follow us and we'll have employment for all our members. So that's something that we are looking into as a change of tack, because if the government sometimes It's just the government. If they decide to frustrate you, then they'll do that. But we have not given up. We cannot chase them out of the country, but we can be able to continue pushing for the employment. You saw the union's strike notice was to employ 2,000 doctors. But I think we need, that is a short-term measure. As a long-term solution, we need to actually think about how we can be independent of errant government policies. And this has been effectively done in countries like Italy. It was done in France. It was done in US. If you look at the history of how doctors became empowered and rich in those countries, they had to go the cartel way, where they came together and were able to negotiate and provide the service at a cost to the government. And that's what we are looking at doing.
Thank you. I hope Benjamin is now okay with that question.
Yes, I am. Thank you so much, Dr. Ari, for that response. It's a good move and I applaud it.
Okay, I think Cheryl had raised her hand as well.
Sorry about that. I was trying to get the chat box.
Okay. Okay, Doctor, before anyone else asks a question, or as people are planning to ask more questions, which I hope they are, what would your advice be to the executive board elect and MSAKE? How would you advise them in their next term of leadership? What should they do? What should they have in mind as they're leading people?
First of all, I'd like to congratulate them for being elected into the executive board. What I'd advise them is they need to have unity of purpose and a well-defined strategic plan in terms of what they need to achieve within their term of office, and then work together in terms of fronting those particular interests. So work, have unity as a board and have a clear goal of what you want to achieve, and then implement it, and we'll be able to work with you as KMA and support you in that journey.
Okay, thank you. Thank you very much for that. I hope those that are here have heard what you have told them. And with that, I think we have come to the end of the Q&A session. If there's no one else who wants to ask a question. Okay, I will take that as a yes. Thank you, Dr. Were, for being with us today. Thank you for answering our questions. I'm sure there are more, and if there's someone who has a burning question, I think they can contact you in future meetings that we have with you. We have learned a lot. I have gained a new perspective, different perspectives on the things that you have mentioned in the questions that we have asked you. And thank you for being here today.
Thank you, Marlene, for having me. And I look forward working with all of you so that we can make a better future for all of us. Asante.
Karibu. So on to the next section of our closing ceremony. You have had different people speak. You have had Cheryl speak. Dr. Were has spoken, and it has been an interesting session. You have
Now we can go. We can go now if the meeting is still out.
Oh, sorry for that. So our next speaker is the MSAKE Secretary General elect. I hope he is able to speak. He's been traveling. I don't know if Ezra is here yet. Sorry.
Hello everyone. I'm Ezra Masinde, the Secretary General elect. I want to hope you can all get me clearly.
Yeah, we can.
Yeah. I had wished to actively take part in the sessions that have been going on, but then I was held up on the road. I was traveling a bit, and then yeah, I'm yet to get home, but then I decided I cannot miss this part of program, so I decided to stop over somewhere and at least attend to this. So first of all, I'd want to welcome my team and introduce them so that you can be familiar with them. I'll start. Anita. Anita, kindly just introduce yourself and what you stand in for in the new EB.
Okay, thank you, Ezra. My name is Anita Wamboe Mwaura. I'm a fifth-year medical student at the University of Nairobi. I'm the National Officer-elect for the Standing Committee on Research. Thank you.
Okay. See Keegan, Victor Keegan.
Yeah, thank you, Ezra. My name is Victor Keegan. I'm a fourth-year medical student at Moi University, and I'm the National Officer-elect for Professional Exchange. Thank you.
Thanks, Keegan. I can see Sharon.
Hello, guys. My name is Sharon. Sorry. My name is Sharon Lazera. I'm a first-year medical student at Kenyatta University, and I'm the National Officer-elect for SCOP. Thank you.
Okay, thank you. Hope no one has been left out. The other ones, I think they were unable to make it to this session because of one reason or another, and it is under we understand. So first and foremost, to state the fact that as the new Secretary General, I'm committed to ensure that MSAKE becomes a cutting edge association that is in this region and even globally. And what I'd want to focus on is the basic unit of MSAKE. And the basic unit under MSAKE is the local chapters. So many a times we have focused on what we are doing as MSAKE outside there, or MSAKE, what we tend to forget about the local chapters and the fact that MSAKE is actually built. My biggest intention is to buff up how the local chapters coordinate and work with MSAKE so that we can be able to realize self-sustainability from the level of once the local chapters are able to self-sustain themselves, we can be able to realize great goals in MSAKE. And then another thing that I want to proper guidance and support from KMA and probably KMPDU, that Dr. Were is in the house. Yeah, I want a situation, some funds maybe from KMA just directed, that is in the budget, directed towards running of MSAKE, because I'm sure, Daktari, you've been in MSAKE and you know the challenges that MSAKE normally undergoes, and you have in MSAKE, and now that you are the president, the big guy at KMA, maybe you can be able to find ways to lessen our burden as we also try to work on our end. And then also thanks to the outgoing team, MSAKE is soon going to be a legal entity, so we can be able to be able to have discussions at the national table, and not have to sometimes go through maybe KMA or we can be able to voice our concerns independently as a body, but still we get the guidance from KMA. I don't know if I'm still clear, because it's a bit the rain is a little bit heavy on this side. Can you get me clearly?
Yeah, we're getting you.
Okay, thank you. Yeah, so I'm also impressed by what I've seen going on. That is from KMA. That is the support that we have. I'm hopeful that we are going to continue working together, so that our ultimate goals that we outlined in our applications towards in the long run. I'll beg to stop at that point. Yeah, I think because of the rain and network issues. So thank you for that time, Marlene.
Thank you, Ezra, for that. I'm looking forward to being a MSAKE member under your leadership, and I think the same is for those who are here as well. Thank you for speaking. So before we move the vote of thanks for everyone who's attended this whole GA, I just want to give a special notice to the sponsors that we've had. Thank you to REPUB. We've really worked with them on most of the sessions that we've had. We were supposed to have an abstract presentation as well as awarding, but that was pushed due to some circumstances here and there. I'm hoping that the people who are supposed to present the abstract will still get the opportunity to do that in the course of next week. But thank you to REPUB. Most of the platforms that we've been using have come from them. The sessions of research that we've had have also been facilitated by them. So thank you, REPUB, for your support. And I think I should just mention that if you have any research work that you would like to publish as a student, REPUB has a platform for that, and they do not charge you. It is free to students. So just get in contact with them. They have a website. You can also check it out. I think I'll leave that in the chat box. Yeah, our other sponsor was MediHeal, and no representative was able to make it to the meeting today. I'll just read a small piece on what MediHeal is about, though I'm sure most of us already know. So the MediHeal group of hospitals is the leading, largest healthcare service provider in East Africa, with high focus on quality, cost-effective, and world-class healthcare. Sorry for that. So I was saying, with high focus on quality, cost-effective, and world-class healthcare and respect for human beings, what started with one hospital 14 years ago in Kenya has now expanded to 10 locations, treating more than 1.5 million patients. Driven by a strong interdisciplinary collaboration, the teams of accomplished medical experts deliver personalized and exemplary patient care across 25 plus specialties, leveraging the most advanced evidence-based medicine and cutting-edge technology. Some of the achievements that have been pioneered under MediHeal are 1,000 plus IVF cycles per year, and MediHeal was delivered the first IVF baby in Rwanda. It also had the first laparoscopic donor nephrectomy for renal transplant in East Africa, and it has done more than 50 renal transplants with the highest success rates in Africa. And among the mission values that Mediheal has as a group of hospitals is to achieve and maintain excellence in health education and research and provide for the benefit of humanity. And I think that is one of the main reasons why Mediheal is really one of the biggest sponsors in most of the activities that we as MSAKE and also different local chapters get in the activities. So thank you to Mediheal. Thank you for the support that you have given us today and in this whole GA at large. And we look forward to working with them in the future. So at this point, I would like to invite Cheryl to move the vote of thanks. And as the chairperson of the organizing committee that brought this all together, she will close this for us as well. Welcome, Cheryl.
Um, Thank you, Marlene, for this opportunity and for moderating this session. So I wasn't able, I had gotten home at the beginning, so you can share a bit of experience as well properly now. So my friends during the year, it's been amazing, eye-opening, and I'm really grateful for the chance I got to all of you and the Simbas especially, and work with them and the staffers. It's been an amazing experience, and as I said, I'm really glad that it happened on him because given the circumstances also and the financial country, it have been very, would have been a bit difficult for students to be able to attend it to the extent they have, and to have this documented and kept is also an amazing thing, and I'm really grateful for that. Also, I would also like to thank the organizing committee. I see we have Marlene Gagan here, we have Eda here, we have Hamza here. I think these are the only ones here. And Absancha, yes, and Pavan Raj and everyone else. I'm really grateful to have worked with you guys. It's been a pleasure. You've made this fun, and you've made it an experience I treasure. And I'm really glad I've made friends with you and had the opportunity to really get to know all of you and work with you. The sirs, thank you so much, Tawere, for sharing expertise and experience on data, on leadership in the medical world. And I would also like to thank the speakers in Nigeria who facilitated sessions and access sessions. It's been amazing to have so many people from different parts of the world come and speak on different topics and give expertise. And I'm very happy because I also have gained a lot of knowledge. I'm definitely going to watch most of the webinars, and I'm really grateful for that you accept our invite. We have had many workshop sessions on global policy and advocacy, UHC, meaningful youth engagement, pandemic preparedness, and healthy, and the steering committee sessions as well. And really like to thank the team members who moderated sessions and consolidated the different strategies for each of them. Thank you for your dedication in that, and also the Senate Committee of National Officers for coordinating sessions. They were amazing, and thank you so much for taking your time and dedicating yourself to work on this. Next, as Marlene mentioned, our sponsors, I would just to thank them. I would thank Mediheal for their support, their community support. They keep supporting in some MSAKE activities, and I'm really grateful for that. For REPUB and the extensive work research, I'm really grateful that they keep showing medical students responsible, and I'm grateful that they agreed to help us on this. And for Docspace, which is a platform, it's an application that you can find on Google Play Store, where you can connect with docs. It's like a treat of medics, basically. So I think that would be, they've been charging our stuff, and I think it would also be really nice if you check them out. you'll get a lot of insight from there. And I'd also like to thank the participants for joining us today. Thank you for attending all the other sessions and this particular session as well as the ceremony. It's been a thing to interact with all of you. I really hope you did as much as I have. And it's really my joy to know that you have left this, after you've left the GA experience better than you were before. And yeah, with that, I'd like to say that it's been a pleasure to serve, and we hope that you stay connected through the YouTube account, through the WhatsApp accounts that are from MSAKE, and the MSAKE IG page and Twitter. We hope to keep connected with you guys. We'll have a magazine out soon, so you can have like a memoir, if you could say so, yeah, and certificates will be given out. And lastly, I also want to say that this is not the last session. We have a talent show at 6:30 p.m. time. And we like, if you haven't applied for that yet, just send your name to I will send the contacts in the chat box as we continue. And I hope to see you all. Come, let's have fun. Close the GA. Yes, and with that, I would like to thank you all again for being here and for sharing this experience. And have a Merry Christmas and a Happy New Year. Thank you.
Okay, thank you, Cheryl, for that. And before we all leave, because we have come to the end of the closing ceremony, I want us to take a photo, a screenshot. So if everyone could just turn on the video for a photo that we will use in the magazine. Let me just see who is on.
Okay, maybe.
Okay, I think we're just waiting for one person. Or 3 now. I don't know if Sharon will be able to turn on your camera. Sharon?
Hi, sorry, can you do it next time?
It's okay. It's okay.
Sorry.
It's fine. Okay, Gagan, you can now take it. Say cheese.
Dr. Wary, you can smile. I'm concentrating looking at the camera. So,
Gagan, are you ready? Are you done?
Yeah. Thank you.
Okay. Thank you, everyone.
thank you, guys. Bye bye.
And leave with pleasure.
Okay.